Hello, this is Ultan here from Health West Community Pharmacy in Ballandine. It's hay fever season again, so I'm just going to run through a few of your options in terms of hay fever treatment when it comes to over-the-counter treatment in the pharmacy. The general rule of thumb, if you've suffered from hay fever before, is to call into your pharmacist and have a chat. You'd normally start off with a tablet if you were looking for treatment. And that's non-sedating antihistamine is usually what people take. There are a number of them available, so both brands and generics. I can show you a few of them here. So we've got loratadine, 10 milligram Lorat. That's the same as a tablet called Claritin, would be the brand leader originally. So loratadine and Claritin, one a day, like that, non-sedating. Most people find it non-sedating. Some people can actually find them sedating, so it's just important when you're trying them out first not to go driving and stuff like that if you feel you're susceptible to that. The other alternative to loratadine as a medicine, a non-sedating medicine, is cetirizine. So cetirizine is in Zyrtec, which you're probably familiar with, or certainly would have heard of. And again, there are generic medicines available of Zyrtec, of cetirizine, like Cetrine and antihist. They're the same ingredient. So baseline antihistamine. You can get Piriton as well. Some people find very good. It is sedating, a little bit more sedating than the others anyway, and it's 4 times a day, so it's less convenient. But like that, if the other ones aren't working for you, it may be an option. And there are antihistamines available on prescription if you happen to have a medical card, or if you prefer to go and have a chat to your doctor about it. Combination products, just to touch on them, antihistamine and decongestant together. So maybe when you're starting off, if you find your nose is very bunged up, the combination of Zyrtec and pseudoephedrine in that can be useful. So that's Zyrtec plus decongestant. It wouldn't really be ideal for ongoing treatment, so the idea would be maybe use that for a few days and then go back to the Zyrtec itself, or a generic of the Zyrtec, just to keep things under control. So if your daily antihistamine doesn't keep things under control, the next step up then will be to add in either a nasal spray for nasal symptoms, or eye drops if it is a thing that your eyes and nose are giving you trouble. Nasal sprays, just going to again an example of a few different ones here. These are steroid nasal sprays, so Nasacort allergy, Flixinase once a day, again Echinase twice a day, and it's from 6 years up. The other two are 12 years up. The Dynametazolines, the things like Atropine nasal sprays and Vicsinex nasal sprays shouldn't be used for any longer than 7 days, whereas these, they're steroid based and they can be used on an ongoing basis. So that's to be added in after your antihistamine if the antihistamine isn't hitting it. There are some nasal sprays that are for allergy rates prevalent that doesn't actually have steroid in it, and they can be quite useful as well to try out. So that's your nose. So baseline antihistamine, 1 tablet a day or 4 times a day if you're using your Piriton, cure with the drowsiness, like I say. Nasal spray then on top of that if you do need it, and if that's not controlling it, then you'd be looking at either going back to your GP or having a discussion with the pharmacist around other options. If your eyes are giving you trouble, we've got an example of an eye treatment here that can be added in again, Opticrom allergy. It's a mast cell stabilizer, it's called. So it just basically stops your eyes immune system, we'll say, from causing the wateriness and that sort of runniness that you can get with hay fever. You'll know it's hay fever rather than an infection, in that you won't have a stickiness or necessarily kind of a yellow discharge or stickiness in the morning that could be a sign of infection. So just to be aware of that. Optrex eye bath can be useful for just washing pollen out if your eyes are irritated. And the only other 2 things I have here are liquids. So for children, Zyrtec liquid or antihistamine liquid are again cetirizine liquids that can be used from 2 years up for children, and that as well. So that's it. Hay fever, some hay fever treatments. If you do find that it's creeping up on you, as it has a lot of people this time of year, do call into the pharmacy, have a chat to your pharmacist or the person over the counter, have a chat about your options in terms of your antihistamine, your nose, and your eye drops, and we'll get you sorted. So thank you from Health West Community Pharmacy in Ballindine.